Thanks for joining us. First at 10 tonight, the federal government giveth what the governor taketh away. That's because the CDC is bypassing Governor Bill Lee's recent cut to HIV funding. It's doing that by giving $4 million directly to the United Way of Nashville, which will then share those funds with organizations in Memphis and around the state. Our Zaria Oates found out the move by the CDC is causing a sigh of relief for those fighting the spread of HIV. Zaria?
Richard, HIV is an undereducated disease impacting thousands here in the Mid-South. Those surviving the disease are now making a career out of it and say oftentimes you just have to stand up for what you believe in.
Sometimes you have to call out the politicians or get in touch with them to let them know how important the funding is.
The nearly $9 million that was supposed to be given to the Tennessee Department of Health through the CDC is now down to $4 million and being funded to local organizations through a loophole. This comes after Tennessee's refusal to take money from the CDC for HIV services. The CDC, in turn, making a deal with a Nashville organization to keep HIV resources flowing through the state.
We are super excited that the CDC has taken a major step to make sure that community-based organizations across the state have a different way to be funded.
But now state and local organizations are having to find different funding avenues as Memphis remains in the top set of cities with HIV infections.
We are still number 3 in new HIV infections when you talk about larger metropolitan areas, only behind Atlanta and Miami.
Not only could the cut in finances impact HIV testing, but it could also have a trickle-down effect to the resources those with HIV are able to get.
Being able to sit down with a doctor and they explain everything, and that's one thing that I don't want to lose as far as funding with HIV, is that we do have good providers here that will, with clients that are newly diagnosed, like I was, that can sit down and ensure the client that it's going to be okay.
As funding for HIV stays afloat across the state of Tennessee, those who are impacted most are still on edge, seeing no clear end in sight of what this means for their funding. But they're hopeful and encourage anyone who thinks they may need a provider to get tested or call your local HIV testing site for more information. We did also reach out to Republican legislators for comment and have not yet heard back. Richard?